Okay, bile duct is right there. Okay?
This is the bile?
Right there.
Where's the test?
Oh wait,
That little thing?
it's a male, but the
It's a bile duct.
That's a bile duct.
Okay.
Okay? And not the bile duct, that's the gallbladder.
Oh, gallbladder.
The bile duct,
Right.
the bile duct is this tube right here. And unfortunately, it has a little bit of latex in it. So I probably wouldn't use it.
So we're here?
Yeah, you can feel it?
Yeah.
Feel the tube?
Yeah, I can feel it.
Okay, and the big yellow one, anybody remember what that is?
The
cranial
hepatic.
Hepatic
No.
artery. Yes. No.
The hepatic pathway or portal.
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 Excellent.
There you go.
Here's the celiac, right? It's free floating. And that's going to administer to the intestines and stomach and so on. It has multiple branches. And one of the branches you can see here. Here's the celiac coming in, and then there's this little one that kind of go back this way. Unfortunately, it has a familiar name to you, but that is the hepatic artery, not the hepatic portal. So right here in this little area, we have the celiac, which is the free-floating one, the hepatic portal, which is always yellow. I'm not going to put a pin in something that isn't yellow, so get to know the coloration. The red little one is the hepatic artery, and then the one on top of that, this tube right here, that if you follow it will go right into, yes, that's the bile duct. Okay. So it's going in right where the intestine meets the stomach, the pyloric stomach. So remember, this is the cardiac stomach. The pyloric stomach is S-shaped, and it's not really good on this one because it's kind of mushy and torn. So, but anyway, it kind of comes down and makes an S shape. Then we have the pancreas, and there's usually a couple lobes of it. The spleen right there, the intestine, and this is really a goofy intestine. I'd never stick a pin in that. It's, I'm looking for cosmetics and popularity when I.
We're looking for the new star.
Right. So, and then somebody asked about the testes. Here they are up here, right? One on each side. Okay.
This one or that. Do you know if you're going to use a male or a female shark?
I'm going to be using all of them.
Oh.
So that's what I said. If you have a male, be sure you take a look at female.
Gotcha.
Okay, now.
Would you be pointing at the spiral down?
Yeah, but not on this one. So one of the things that I want you to do today is to open up the stomach and open up the intestine. Now the intestine has what's called a spiral valve in it. And actually, if you look at the orientation of the blood vessels, you can see that they do kind of spiral. And what that means is that the intestine of the shark does not have to be convoluted. It has that spiral, like a corkscrew going through it. So it slows down the nutrients, aiding in absorption.
Should we just cut them open or cut them in half?
Yeah, just cut them open, but kind of don't
Like
cut.
slice it?
Yeah, don't cut in the area of the posterior intestinal arteries and veins. Okay, and these have been cut. You can see them right here. Right, there's the posterior intestinal artery right there, and then the vein is yellow. Okay, so they've been snipped. So this one perhaps isn't the very best, but be sure that you take a look at some of the others in which the vascular system is very well done. Then the renal or rectal gland right there, with the superior mesenteric artery coming to it. You don't need to know that artery, but that rectal gland. That's the salt gland for this animal. And then right in the middle is the dorsal aorta. On either side are the pair of cardinal veins, not really well shown here, but you can see I can pump fluid through it using my fingers. And then on either side are the kidneys. Now in the males, you can see a whole bunch of little squiggly tubes, right? Those are the Wolffian ducts, and they are going to take sperm and deliver it down to the cloaca and ultimately to the claspers for fertilization. Yeah, see the little tubes in there?
Yeah.
In many cases, the sperm is immotile, so it has to be directly injected.
Is the female, have similar ducts?
They do, but they're not going to be as prominent.
Not gonna be.
Okay. And then on the side is the lateral abdominal vein, the most conspicuous blue vein there.
How pretty.
Okay. And claspers, cloaca. Let's see. Yeah, this one has a pretty good renal papilla right there. See that little triangular thing? It's set off to the side, and you will not see it, but there's little holes that come out. That's where the urine is ejected, through that renal papilla.
Where's
So
the
this-
salt ejected?
In the same area. Right? So
The
it's the
cloaca is
rectum.
like an all-purpose hole.
Yes, exactly. That's it, exactly.
Kind of bad to say that, but it's true.
So the whole inside area is the cloaca.